Dr. Jaffe, do you know common causes of vertigo and what are some strategies to help resolve it?
Well, having had what's called paroxysmal idiopathic vertigo about 4+ years ago, I know a little bit about vertigo. And there's the vertigo that most people talk about, which is they are able to walk around with their eyes open and so forth, but every once in a while, and maybe much of the time, it feels like they're a little unstable or things are beginning to spin around. Now, paroxysmal vertigo is a little bit more intense than that. And for about 4 hours, I was in a fetal position with my eyes closed, my cell phone in my hand, people around me who were concerned, and I kept explaining that I would get through this, which I did, fortunately. So vertigo means the world is spinning around. It mostly has to do with your ears, mostly the middle ear. And there's a very interesting technique, and I think it's called Epley. It's been a long time since I thought about this, but there's a chiropractic technique in which you position the head in three specific positions for a certain period of time so that the little tiny collagen fibers, each of which has a tiny crystal at the end of it, that has a length and a geometry that vibrates with different frequencies, which is how we can hear sound. Sometimes those little delicate collagen fibers get intertwined with each other, mixed up with each other. And this technique, chiropractic technique, is designed to allow those collagen fibers to unwind. So that's one cause of vertigo. Then there's a cause of vertigo due to toxin exposures. So if you're exposed to toxic metals, if you're exposed to solvent residues, if you're exposed to hormone disruptors, isotopes, or mold products, the effect on your body can cause swelling, a small amount of swelling, but swelling, in the inner ear and eustachian tube. And the consequence is, not only do you feel the room spinning around, but you can feel like you're kind of underwater because there's too much water in the middle ear. Then there's vertigo that occurs because of certain medical therapies, and the answer is to discontinue or substitute for that therapy something that doesn't induce neuropathy, because one aspect of neuropathy is vertigo. And then there's a kind of vertigo that has nothing to do with the ear, but everything to do with the cerebellum. Now, the cerebellum you can think of as a separate kind of brain at the base of your skull. It's protected and deep. It's primitive, but it knows how to sense the world. And you sense the world in three directions: up, down, in, out, side, right, and left, three directions. If you are overstimulated in that cerebellum, you can feel a very unusual kind of vertigo. So there are different causes to vertigo. Someone who is knowledgeable about these conditions, as I've become, either from experience or from practice, knows how to differentiate them. There are certain basic tests of how well you can stand with your eyes closed on one leg or the other as a measure of cerebellum. There's pencil tapping. You have two circles about 4 inches apart. You give person a number 2 pencil, and you ask them to tap back and forth as fast as they can for 1 minute, and you then count how many of those taps yielded a mark inside the circle versus outside the circle. If you have vertigo based on cerebellar problems, you will have more taps outside the circle. If your vertigo is middle ear, you'll be able to stay inside the circle. So there are inexpensive, very often forgotten old-fashioned tests. And I'm glad to say that I'm old enough to be old-fashioned about some of these understandings that are worth remembering. They're worth going back and finding how did we assess vertigo, the ability to stand without feeling the world was spinning around. How did we assess vertigo before MRI and CAT scans? How did we assess vertigo before we ran to a symptom-reactive therapy before understanding the cause. As you know, I'm interested in the cause so that you can use something safer and more effective, and in the case of vertigo, that certainly was my experience. Fortunately, mine was idiopathic. We don't know why it happened. It hasn't re-happened, I'm glad to tell you, but it certainly was a life lesson for me in redoubling my commitment to living joyfully the alkaline way and to sharing the message as best I could for the time I had to share it.